said he felt funny and then he just collapsed.
Does your chest hurt?
29 Daniels Lane, Sagapana. Hey, come on, hurry! What do we got?
Cardiac arrest.
Let's have a conversation today about longevity, about living longer and living better. And how does cholesterol affect that? All right, so how do you live longer and live better by reducing your cholesterol levels? We've all heard of so-called bad cholesterol, LDL-c, low density lipoprotein cholesterol. All right, so it causes cholesterol plaques that form in your coronary arteries, your heart's arteries, and those plaques can break off and they can occlude or block the blood vessel. And that stops oxygen from going to your heart. So whatever you hear on the internet, whatever any biohacker tells you, that LDL-c does not cause plaques or does not cause heart attacks, that's just wrong. Cardiovascular disease is the leading cause of death in America. It's the leading cause of death worldwide. So any conversation that we have about longevity and living longer needs to include a conversation about reducing our cardiovascular risk. It needs to include a conversation about lowering our cholesterol and lowering modifiable risk factors. All right, so how do we do that? Exercise is a part, diet for sure, all right, controlling blood pressure, avoiding diabetes, and yes, reducing cholesterol levels. So let's talk a little bit about the details because I love talking about how high is too high and how low is too low. If you have an LDL-c of 60 milligrams per deciliter, so 60, that sounds like a low number, but it's not a low number if you're a secondary prevention patient. If you're a patient who's already had a heart attack and you're trying to avoid a future heart attack. 55 milligrams per deciliter would probably be your goal. Well, how about an LDL-c of 100? Maybe that's too high for you. For some people it is for sure. How about 130? Probably. How about 150? I don't know why any physician in America is okay with an LDL-c of 150. And 190? 190 should be a 4-alarm fire. It should be the starting place for a conversation about genetically high cholesterol, starting place for genetically high risk of cardiovascular disease. Something called FH, or familial hypercholesterolemia. All right, so you need to know your number and you need to know how it relates to you and your risk level. But medication is an important part for lots of people. It's an important part for people at especially high risk and people who have high levels of cholesterol. So what are some of the medications? Crestor, Lipitor, those are statins, something that gets a bad rap on the internet, something that probably shouldn't, because they save lives, they increase longevity. It's about finding the right patient. Bempedoic acid is a newer class of medication. It works a whole lot like statins. Zetia, that's a medication that blocks cholesterol absorption in your gut. Or PCSK9 inhibitors, something like Repatha. So that's a once every 2 weeks or once a month injectable. It's a monoclonal antibody, and it's incredibly effective at decreasing your cholesterol levels. And that's a medication for people with FH or a medication for people who have already had a heart attack. But you need to know your number, you need to know your risk, and you need to know the options available to you. And you need to have an honest conversation with your physician. An honest conversation about your goals and how to make a personalized approach to the treatment and the therapy you need. All right? So we're going to be talking a lot about longevity, a lot about how to live longer and live better on this channel. Having a healthy cholesterol level is one part of that. Look forward to seeing you the next time.